Good morning, everybody, and thank you very much for coming here. Here in Cincinnati, we are very passionate about trying to improve the understanding of systemic juvenile idiopathic arthritis, and I don't think I can stress enough how important it is for us to hear your voice and to understand your perspective on the unmet needs in the management of this disease. Now, if you think about the history of the treatment of juvenile idiopathic arthritis, I think what made a huge difference in the management of this disease was the introduction of IL-1 and IL-6 inhibiting biologics. The appropriate use of these biologics led to a dramatic improvement in the outcome of typical features of systemic juvenile idiopathic arthritis, such as joint disease. As a result, this kind of joint damage that we used to see very frequently now is becoming exceptionally rare. But we still have quite a few challenges to address. About 15-20% of the patients with systemic juvenile idiopathic arthritis do not respond to the existing treatments or do not tolerate them. So there is a clear need to identify new therapeutic targets, and Dr. Benedetti will discuss this issue later today. Unfortunately, the rate and the severity of macrophage activation syndrome remained unchanged, even in those patients whose disease is controlled very well. So there is a clear need for new medications to treat this complication, as well as biomarkers for the early diagnosis and appropriate monitoring of disease progression and response to treatment. And most disturbingly, over the last several years, we started seeing increasing numbers of patients with this very strange, previously not observed previously lung disease that may be life-threatening. We don't understand the reasons for this to happen. Our understanding of the pathophysiology of this phenomenon is certainly improving, and in a few minutes Dr. Grant Schuller will discuss it with you. And we still have a very poor ability to diagnose this lung disease early before any kind of irreversible changes occur in the tissue. In addition, lots of kids with systemic juvenile idiopathic arthritis still struggle with significant growth delays. And another issue with the increasing use of these biologics combined with other immunosuppressive medications, we're seeing lots of strange infections. And again, that's something that we need to understand a little bit better. Again, this will be discussed later today in one of the lectures. So what we would like to achieve today is to, through several formal lectures as well as informal roundtable discussions, to review the progress in each of these areas that I just mentioned. And again, on our side, we would like to understand what's your perspective on the unmet needs in the management of this particular disease. And then we will be happy to answer your questions about the disease and its treatment. Now I would like to introduce Dr. Grant Schuller, who is an assistant professor in the Division of Rheumatology here at the Children's Hospital in Cincinnati. And he is leading the basic science research program that is focused specifically on the pathophysiology of this seemingly new lung disease. Dr. Schuller?